Hi, in this lecture I want to introduce some of the basic definitions and key concepts of Kaizen. So the word Kaizen is a Japanese word, and you can see the two characters here, the kanji characters. Kai means change, and the other character Zen means good. So Kaizen translates literally to mean good change or improvement. There's a big distinction between the idea of a change in the workplace and an improvement. A change is just different. It might be better, it might not be. A lot of times people get upset about change because it's not better, or they might get upset because they weren't engaged in the change process, the improvement process, which is something we'll cover later. If it's an improvement, I found that people tend to be far less quote unquote resistant to change. When it's a change for the better, in the context of continuous improvement, people like improvement. People like making things better in the workplace, and that's really what Kaizen is all about. Kaizen is both a set of methods and particular tactics and things that we'll do. But Kaizen is also really, I think, a culture. It's a set of management practices. What do we think? What's the underlying philosophy to what we're doing in the workplace? What do we say to people? And what are we doing to take action? How are we engaging everybody in improvement? So we want to keep both of these in mind. The methods without the culture might not get us anywhere. Just talking philosophy and not taking practical action probably isn't going to be helpful either. So, with Kaizen, one thing we're doing is changing a culture from one where people just complain to one where people are fixing things. And this is transformational, not just in healthcare or in manufacturing. But I taught a class about a year and a half ago, and there were some managers there from a really large retail coffee shop chain. And they went back and they implemented these Kaizen methods that we're going to be using and learning about in a number of their stores in the back rooms. After a couple of months, I followed up with one of those managers who was really happy with the increased level of engagement and problem solving and improvement. And this manager said, one of the employees said, we're great at identifying problems. We just don't fix them. But now we feel empowered to fix things. And again, that's really what Kaizen is about. Not just pointing out problems, but working together to make improvements happen. So Kaizen, you might be familiar if your organization is using a broader approach to lean, that Kaizen is one of the two core pillars of what Toyota calls their Toyota Way management system. You see on the left, Kaizen, or continuous improvement. On the right, you see respect for people. These very much go hand in hand. We can't really have one without the other. Because we respect people, meaning our patients, our staff, the physicians, our suppliers, the community, our volunteers, we're driven to make things better for all of their sake. And the way we get continuous improvement is by engaging all of those different people in the process. It's not about forcing changes on them. It's about engaging everybody in making things better. So one example here, this is from the Franciscan St Francis healthcare system. So the co-author for the Healthcare Kaizen books is Joe Schwartz, and he's been their director for 7 or 8 years, leading this culture change. So this is an example of what we're going to be working toward in this program, of documenting simple Kaizen improvements that are implemented in the workplace in a single page format. So in this example, you see the before side of the equation. There wasn't a process in place to notify parents or staff of a baby's last bath. So parents are unaware when baths are going to take place. I'm sure that led to a lot of questions, a lot of interruptions, a lot of uncertainty or unhappiness. And on the right, you see the after, that they created a simple laminated paper duck sign that says my bath day is, and they update it, and you can see the nurse's name. That's the before and after. They found a problem. They implemented a small, simple improvement. They documented the effect. It says better parental satisfaction, improved staff communication, more consistent baths. And you see all the names of the people involved. Because Kaizen is very rarely an individual activity. It's a team sport, if you will. So we give recognition to everybody that was involved when we document and share a great idea like this one. Now, sometimes small improvements have a really big impact. Here's an example from an academic medical center where the problem was stated, it was written up as patients are going to outside specialty pharmacies. And the person who came up with this idea was thinking in terms of patient convenience. Why are they making another trip, driving someplace else to get a prescription filled instead of taking advantage of our in-house pharmacy? So their small improvement was that they introduced a small education step into the patient visit, not being coercive, but saying, hey, did you know we have a pharmacy here that'll have better clinical integration, it's convenient, they can take care of your prescriptions. And they piloted this new approach in the endocrinology clinic. So it's the idea of having a small test of change led to, as you see documented in the result, more than $600,000 in additional revenue in the first 3 months. So that's $2.5 million of additional net revenue for just one clinic that came from simple, inexpensive approach. Not spending a lot of money, but a small change that, as we see, sometimes had a surprisingly and wonderfully big impact. That happens sometimes with Kaizen. So the word Kaizen has actually been floating around in healthcare for 25 years. Dr. Don Berwick from the Institute for Healthcare Improvement published an article in the New England Journal of Medicine in 1989. You see the title here, and you can find the article online. Continuous Improvement as an Ideal in Healthcare, about this continuous search for opportunities for all processes to get better. Well, that sums up Kaizen perfectly. And it is an ideal in healthcare. I think the challenge that we face is moving from where we are today to that ideal condition. And that's what we're hoping this workshop is going to be all about. Helping you create that culture of continuous improvement, getting started, building upon it, sustaining and nurturing that culture over time. Because as Masaki Imai says, who you see pictured here, he wrote a book that was published more than 25 years ago called Kaizen. And Don Berwick cited Mr. Imai's book in his journal article. Kind of the seminal book that introduced the word Kaizen to the Western world. Mr. Imai, who's still active today, as he says, Kaizen is about everybody improving everywhere and every day. That's really what it's all about. And so that's what we're going to explore more as we go through the different lectures in this series.